Days. We are joined by Dr. Syed Hussain of Trinity Health this morning. Good morning. Thank you for joining us.
Thank you for having me.
We have a lot to get to this morning. We are talking about Princess Kate. There's been a lot surrounding her, but recently she announced that she's been diagnosed with cancer and she's undergoing, quote, preventative chemotherapy treatment. So what is preventative chemotherapy treatment?
Right. So what we know about the princess is that she underwent abdominal surgery, thought initially to not have had cancer, but a subsequent test did prove that she has cancer, and she's in early, quote unquote, early stages of chemotherapy. So it's also known as adjuvant chemotherapy, and so this is used when there are microscopic cells, cancer cells, really small cancer cells or clusters, and to eliminate those so that there's no cancer recurrence. And it's a bit of a misnomer because there is no such thing as preventive chemotherapy, where if you're not high risk or you're not diagnosed with cancer, that you can get this to prevent cancer. There's another term called chemoprevention, where if there's an individual who's high risk for cancer because there's a family history of cancer, like breast cancer that runs in multiple members of the family, they may get tamoxifen or raloxifene, other drugs that can prevent cancer recurrence from happening. So there's a difference here between what she's undergoing and what some other high-risk individuals may take.
Gotcha. Now, there's a lot of people who are beginning to become interested in getting those kind of testing done in younger age groups, rather. That might be something that older people tend to look out for. Now, would you say the number of younger people getting tested is due to, the lineage, or just more people actually becoming infected? Yeah,
there are more cancer diagnoses, Symphony, so it is alarming. We've seen in the last 10 years, the rate of cancer diagnosis in adults under the age of 50, so relatively young age cohort, is actually 13% higher, and much, much higher compared to where we were in the 90s. Okay. And we also know this is a difficult group in terms of getting them to get those annual wellness visits, get the age-appropriate cancer screening done. We also know that recent guidelines have reduced the age for colorectal cancer screening, for instance, from age 50 to 45. And there are a number of factors that are in play: inactive lifestyle, and consumption of highly processed food, but we still trying to figure out why we're seeing this explosive rise in cancer in young adults.
Gotcha. Another hot topic gaining a lot of steam. Everyone is talking about Ozempic and Wegovy, but there's been a pretty interesting connection here amongst female users. So some females who say that they've struggled with infertility and have been using birth control or are getting pregnant through the use of this drug. What correlation? Where is the correlation?
Yeah, let me try to explain how the mechanism of this drug is. So basically, women who are on Ozempic, and if you're taking a oral contraceptive pill, birth control pill, because of the high metabolism created by Ozempic, that pill effect will be gone, will be out of the system. So the pill becomes ineffective in a way. And also there are women out there who have PCOS, polycystic ovarian syndrome, which can lead to insulin resistance and infertility. All of those are helped to a large extent, especially insulin resistance and obesity, by Ozempic. So those individuals, will be able to conceive. Now, what it is not is some sort of, magic fertility pill.
Gotcha.
Ozempic is not that kind of pill. It's just, I wanted to make sure viewers understand the mechanism. And if you are on Ozempic and you are taking birth control pills, please make sure you do have a discussion with your healthcare provider. And in the event that you do get pregnant or test pregnant with a home test kit, for instance, make sure you have a discussion with your physician.
Alrighty, definitely some helpful information. I'm sure that might have thrown some people off.
Right.
All right, well, thank you so much for joining us this morning. We're going to check in